Exosome treatment for Buerger's. Exosome therapy is a relatively new approach that involves using exosomes, tiny vesicles secreted by cells, for various therapeutic purposes. Research into exosome therapy is ongoing and showing promise in a variety of medical conditions, including tissue regeneration and immune modulation. Its specific application for Buerger's disease, Thromboangiitis Obliterans, is still in its early stages. Evaluation of patients' wound healing in cases of gangrene or ischemic ulcers. Improvements in wound healing rates, reductions in wound sizes, and avoidance of additional tissue necrosis after exosome therapy can show treatment success in encouraging tissue repair and regeneration. Exosomes from a donor or the patient's cells are extracted, purified, and then given intravenously or locally as part of an exosome therapy for Buerger's disease. Exosomes have anti-inflammatory, regenerative, and immunomodulatory properties that may enhance blood circulation, lessen inflammation, and accelerate tissue repair in limbs that are afflicted.